All right, welcome back. We are covering today section 3, and this section only covers one chapter. This week we're just focusing on chapter 9, which is all about alcohol. So this is going to be an interesting section here, a little bit shorter than some of the other ones because we're really just focusing on this one chapter here. All right. So when talking about this chapter, again, focusing on alcohol, we're going to talk about a few different things. There's a lot to go through in this one, so that's why it's its own section. So we're going to first start off by talking about some different methods of production, so how different alcohols are made. Then we're going to go through, again, talking about these different types of alcohol, what they are, and different components about each of them. Then we'll talk about some views and history sort of on alcohol in the US and how that's adapted and changed over time. Of course, we're going to go through the pharmacology here of alcohol, and we'll take a dive back into Mouse Party, which will be fun. And then we'll talk about some behavioral effects of alcohol, as well as some physiological effects. And then finally, we'll talk about some overall general causes for concern and some negative consequences here of alcohol. All right, so let's go ahead then and start off with methods of production. So there's a few different ways that alcohol can be produced. And the first one is fermentation. So this basically is when certain yeasts act on the sugar in the presence of water, and that chemical sort of reaction is what's called fermentation. And it's the basis of a lot of different alcoholic beverages. It also involves this yeast component where it's actually kind of breaking down some of those sugars and turning them into the chemical of alcohol. This happens a lot of time too in some like fruits. So fruits can ferment and actually produce alcohol. There's some funny videos and stories too of different animals in the wild eating some of these fermented fruits and seeing the effects of that alcohol in those fruits. We also see this sometimes with yeast kind of having a limited tolerance for alcohol. So what that means is basically when that concentration reaches about 15%, the yeast dies off and the fermentation process stops. So it has sort of a natural end to it as well, where it doesn't just keep going kind of forever. It has a natural stopping point where that yeast gets killed by the alcohol. So it balances itself out fairly well here. So after fermentation, we also have distillation. So this is a different method that produces alcohol as well, but it works in a slightly different way. So this is where we also get the term kind of proof from. You may have heard that before, but what distillation does is basically it heats up different types of agents, and that heated vapor produces some condensation of alcoholic liquid, and that is collected and then forms the alcohol itself. And so this is where we get that idea of proof from, where we get sort of that percentage of alcohol in a drink being equal to about half of the proof number. That's where that proof number comes from. It's sort of a formula that is used. So for example, if we had, say, a 90 proof whiskey, it would have about 45% alcohol content within it. All right. So those are the two main methods of production of alcohol, either fermentation or distillation, and each of them kind of is used to produce different forms of alcohol and in different ways here. Let's talk about the different types of alcohol that we have here and how kind of each of them falls into this category. So of course, we can start off by talking about beer. So beer is basically made by adding barley or malt to other different cereal type of grains, and then hops are added in with yeast to give it that flavor and distinct sort of taste to it. So we can also talk here about light beer, which has fewer calories, lighter taste, and tends to have different amounts of water added to it to reduce down that alcoholic content. But as you can see again from this image, there's a wide range of different levels of beer that have different amounts of hops, flavoring, and watered down components to them. So quite a wide range here of this. Then of course we have wine, and this is made from fermenting grapes, right? So looking at that fermentation process. Again, this can be broken down into multiple different types of wine here as well. So when we look at wine. Typically, we know, sort of the red wine or the white wines that fall into this, but there's actually quite a wide range of these different types of wines. Typically, both the names and the types are derived from the location that it was made in, or the type of material that was used to create the wine, so the type of grapes. Oftentimes, that quality level is part of that selection or that cultivation of the grapes. It can vary based on just even the weather or the climate, or even the time that those grapes were harvested. It can again affect sort of the quality of that wine. And then again, we have the traditional, red versus white wine types, but of course there's also like pink or sparkling wine. We also have sweet versus dry wines. And then of course there's also even fortified wines, which are fortified with other forms of alcohol to increase their alcoholic content and often flavor as well. So lots of different types of wine here to kind of discuss as well. And then last, of course, we have distilled spirits. So this also has a wide range of components and types that are part of it here. But normally, the way we kind of classify these is that they contain about 95% of that pure ethyl alcohol, which is about 190 proof here. So these tend to be much stronger than the other forms of alcohol, and then get sort of watered down with different flavors to kind of make the different forms of liquor and things like that. So what we have here is first talking about things that are called grain neutral spirits. So these are really the purest form here of alcohol distilled down into this fashion. They tend to be clear and often have no taste or flavor to them. You might have heard of them sold as consumers as something called Everclear, and oftentimes it's used in research and medicine as well, and mixed with different or watered down with different ingredients. Oftentimes the types of consumer alcohol you might see that this is used with are things like gin, which has that that distillate, that pure alcohol filtered down through different berries, specifically juniper berries, and then distilled or diluted with water. Also vodka, which tends to be mixed again with types of water to water that down. Yeah. Then we also have what are known as congeners. So these are just things that get produced while that alcohol is distilled. So they are present in different types of alcohol, pretty frequently and commonly different types of whiskey here. And they're used in that process to actually provide some of the flavor and different aspects to whiskey and different types of whiskey. So these whiskeys specifically tend to be distilled at lower proofs, usually no more than about 160. But they use, again, those congeners for different types of flavor to be added to it. And then, of course, we also have liqueurs, right, which are similar to fortified wines, where they have different types of alcohol or flavoring added to them to give them sort of that stronger flavor component to them, and also a little bit less on the strength of alcohol as well, normally closer to about 25% for those. All right, so again, lots of different types of alcohol, but they generally fall into the three categories of beer, wine, and spirits when we look at it from this perspective. All right, let's talk now a little bit about some of the different views of alcohol in the US and kind of work through kind of how this has evolved and changed over time. So starting off really early on, like around the time of the Revolution, we actually had people drinking quite a bit of alcohol. In fact, it was said that people consumed more alcohol than they did water at this time. And they were early on, they referred to it as the gods, the drink of the gods, right? That, it was, something that people just used quite a bit. After the American Revolution, there was sort of a movement or a change where it was first sort of classified as a psychoactive substance and started to become more, demonized in American culture. And what we actually had here was what's known as the temperance movement in America. So this was sort of coined by Benjamin Rush, He was someone who basically researched and identified alcohol as being sort of, this first form this first form of actual disease. People that haven't, drink too much alcohol and have a desire to do that. So this led to, again, the temperance movement. And this was the idea that people would basically pledge to abstain from hard liquor alcohols and instead only drink beer or wine. And this eventually, led us down the path of prohibition. So prohibition was, a period of time that lasted quite a bit and varied over time. It started off between 1851 and 1855. We're just about this. There were 13 states that actually first outlawed the use of alcohol. But by 1917, so, 60, 70 years later, almost 64% of America had outlawed alcohol. However, that didn't mean people weren't drinking it. People still drank illegally. And we had things like those speakeasies, where private clubs where people would still go and drink alcohol. So eventually there was a movement, and the federal, regulation ended up prohibiting alcohol across the U.S. And this was done through the 18th Amendment, which banned the sale of alcohol altogether. Of course, that still didn't stop people from drinking. People still drank. It was just, illegal to do so. And the enforcement of this amendment was challenging, to say the least. So when we talk about sort of prohibition, we can talk about some outcomes of it during this time. So one of the major outcomes was that organized crime really kind of became much bigger, in the US. We had things like, the gangs and things like that coming around, where people would use their own private illegal sale of alcohol to, produce wealth and money. It also did have some positive benefits, where alcohol dependence and alcohol-related deaths did decline. So, people were presumably using it less than prior to the Prohibition movement. However, around 1933, the U.S. repealed the 18th Amendment. They repealed that federal outlawing of alcohol, which was done through the use of the 21st Amendment. That's what repealed the 18th. So some of the reasons for this appeal were that, of course, they're missing out on that taxation revenue from alcohol. So they wanted to kind of get back and revive some of those sources of revenue for the U.S. And then, of course, there were some general concerns about widespread disrespect for the law, right? Because people were breaking it through still consuming alcohol. And so there was concern and worry that people would just generally start to disregard laws because of this. So some outcomes of this repeal. So no longer prohibition. What were some outcomes of that? Generally, alcohol sales and consumption increased in the U.S., right? It rose again. And it actually returned to the level that it was pre-prohibition. And so really kind of reset the stage back to where we were. And then, so how do we kind of deal with it now, and what became after sort of the repeal of prohibition? So some states stuck with it. Some states still had their own state level prohibition that was around, and that they still maintained that illegality of alcohol. However, most states at least allowed the sale of beer. And actually, interestingly enough, Mississippi was one of the very last dry states which only incorporated alcohol purchase in 1966. So in the 70s, actually, we started moving in the other direction, where states started to think about lowering the drinking age. So 30 states in the 1970s actually lowered that drinking age to 18 or sometimes 19. However, with some concerns, especially of young people dying in alcohol-related like driving accidents, it was raised back up to 21. And then, of course, we have general taxation and revenue to the U.S. from general alcohol sales across the board, which again just brought in more revenue to the U.S. All right, so that kind of brings us to today, where we have our normal standard sales that we're aware of. Some locations not selling on Sundays, and other places still maintaining sort of that general sale across the board. Interestingly enough, because of different taxation and revenue sources, some of the states that have higher taxation on alcohol, people will drive across the border to states with lower taxation and buy alcohol from those states instead. It's one of the reasons New Hampshire actually has the highest alcohol sale per volume, and that's because Massachusetts has one of the highest alcohol taxes on it, so people will drive across the border to purchase alcohol from New Hampshire instead, which has a much lower tax cost. All right, let's shift gears here a little bit and talk now about the pharmacology, or the methods of action sort of how alcohol works inside the body. So when we're talking about pharmacology, the first thing we really want to talk about here is the standard size of a drink, right? So how much do we consider to be one standard size of a drink? Well, that varies based on the type of alcohol you're consuming. So we can think of it as about 12 ounces of beer, which has about a 5% alcohol content in it, or about 5 ounces of wine, which has about a 12% alcohol content, or about 1.5 ounces of 80 proof liquor. So again, you can see as that content percentage increases, we can consume less physical volume of alcohol to get that same rough equivalent of alcohol into our bodies. So when we talk about alcohol pharmacology, the first thing to discuss is absorption, right? How do we get that into our body? So obviously most alcohol is consumed orally, and what happens is it has to go through our digestive tract. So some of the alcohol starts off by being absorbed in the stomach, but most of the absorption happens after it passes through and takes place in our small intestine. So part of this absorption process with our digestive system means that it tends to be slower if there's food or water present in the stomach as well. And an interesting fact here as well is that absorption is actually quicker. It's faster if there are carbonated beverages present as well. So that's something I think that's important to kind of keep in mind. You can increase that speed of absorption by presenting carbonated beverages alongside the alcohol. We also want to think about how it gets distributed throughout the body. After it's absorbed, how does it distribute amongst the body? And we can think about this as this idea of blood alcohol concentration, or BAC levels. So this is basically the amount of alcohol present in the blood, and it's expressed as a percentage in terms of grams per 100 milliliters. So that's where that number comes from. It's again a percentage basically of the blood alcohol content per 100 grams of milliliters. So that alcohol gets distributed all across the body. So it goes into different tissue, different fluids, including blood, but it tends to not really get absorbed much into fatty tissues. So this is really kind of an interesting kind of effect here. And what this ends up causing is different people to have different basically blood alcohol content levels, even if they've consumed the same amount of alcohol, but it's based on sort of that makeup of the person's body. So for example, if we took two people that weigh the same amount actually, and one of those people is a pretty lean person, not a lot of body fat, but they still weigh, let's say, 150 pounds. And then we take another person that also weighs 150 pounds, but they're less lean. They have more body fat on their body. What happens is that the person with the more lean body is actually going to have so the person with the lean figure is actually going to have a lower blood alcohol content than that of the person who has more fat in their body. So kind of an interesting factor going on here, and again relates to the fact of why different people can experience different effects of alcohol even if they're consuming the same amount as someone else, even someone else who weighs about the same as they do. So a lot to kind of consider here when we're talking about this. When we talk about sort of the next step here along the path is sort of the metabolism. So how do we take that alcohol and metabolize it or get it out of our body? So about 90% of all alcohol that we consume is metabolized in the liver. So that's what sort of breaks it down and eliminates it from our body. About 2% of it gets excreted just as pure alcohol, unchanged, through the breath, the skin, or the urine. But again, most of this is being broken down through the liver. One of the reasons why the liver is so important and so oftentimes damaged in people with severe alcohol syndrome. What else is interesting here is that the amount of alcohol basically that can be metabolized is pretty consistent across the board. So it's about a quarter to a third of an ounce per hour, regardless of BAC. So if you have a high BAC or a low BAC, you're still going to be metabolizing and eliminating about the same amount of alcohol per hour. So if your BAC is higher, it's going to take you many hours or longer to get all of that alcohol broken down and out of your system. Different types of, interventions like exercise or coffee or things like that don't actually speed up the rate of metabolism, so they don't actually sober you up any quicker in reality. All right, so let's talk about now the mechanisms of action, right? So I've got a couple images pulled up here. These are screenshots from Mouse Party. We're going to go through that and let's talk kind of about that first. But just to know, this is mostly acting on areas like the central nervous system, affecting the larger general, components of your body. We're also going to see how it acts mostly on GABA and glutamate. Remember, GABA is that neurotransmitter that calms the body. Glutamate is that neurotransmitter that excites the body. And then we also do see it affect different areas like dopamine, serotonin, and acetylcholine as well. But let's go ahead. We'll switch over to Mouse Party here. And let's go ahead now and we will find the mouse we're looking for today, the mouse who is afflicted with alcohol. So let's go ahead. We'll grab him, put him in the chair, and let's take a look at what's going on at that neural level. All right, so we're going to zoom in again to the brain. And what we see here in this first image is just some general normal functioning of GABA. We see GABA acting, those neurotransmitters acting on those GABA receptors. And remember, when those bind with those neurons are going to be less likely to fire because GABA is an inhibitory neurotransmitter. It's calming down the system, making it less likely to fire. So this is normal functioning of GABA here. In another part of the brain, in other areas, we have what are known as the glutamate neurotransmitters. That's what you can see here, those little orange dots. We see the glutamate neurotransmitter and the glutamate receptors. This again acts sort of the opposite of GABA. It's the general excitatory neuron. So when this binds, it's going to tell those nerves, fire, 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 and they're going to be more likely to send signals. So we have again that excitatory and then also the inhibitory neurotransmitters acting here. So let's see what happens when we introduce alcohol into this system. So alcohol works kind of in multiple ways, right? Almost two fronts. So in terms of the GABA receptors, it actually binds to those receptors, making them more effective, right? They're more, the strength is increased, and that GABA has a stronger effect when it binds to those receptors. So again, making them even more inhibitory, just a stronger inhibitory response. In terms of alcohol's effect on the glutamate, what you can see here is that it actually binds to those glutamate receptors, but it doesn't activate them. It just binds and blocks them. So glutamate can't bind anymore, and so it can't get in to say, hey, excite, send some signals. It can't do that. So what we get is extra GABA toning down the system and a lack of the ability for glutamate to excite the system. So overall, it's just a double whammy to reduce the activation of the system as a whole. And again, then we can look and see kind of where this tends to affect parts of the brain. We see this primarily in sort of those, that frontal lobe, some of those decision-making, impulse control areas of the brain, more of that, area, frontal lobe area of the brain. All right, we'll go ahead, we'll eject him, put him back in with his friends, and we'll switch back over to our slides here. All right, so again, we can see here how it blocks, or how it increases the availability of the GABA receptor to take GABA and makes a stronger inhibitory response, and also how it blocks out those glutamate receptors so that can't be excitatory. So multiple fronts here that alcohol works on the system. All right, let's talk now about some behavioral effects of alcohol, right? So when we're looking at this, what I have pulled up here is first just a chart showing some different general behavioral effects at different BAC or blood alcohol content levels. So we can start off by talking about some of these mood changes, right? And we see this a little bit more so on the lower side of the BAC, where we usually see some maybe feelings of euphoria or reduced anxieties, maybe even reduced inhibitions. So maybe some positive mood changes at lower ends of the scale here. We also see some effects, that might be a little bit more abstract, and it could disrupt some different levels of behavior. But again, this is generally at the lower side of things is where we see most of these beneficial or positive mood changes. When we talk about the BAC effects, we can of course see some of these higher ones. One of the most probably important ones to point out here is probably around that 0.25 BAC level, where this is where we really start to see that severe motor disturbance, oftentimes staggering, sensory perception issues, and oftentimes that severe or that significant level of impairment. So 0.25 is a pretty good point to note as starting to get into some problem areas. Of course, when we're talking about BAC levels, we can bring in here some behavioral effects like driving under the influence or DUIs, right? So this is a huge concern with alcohol, and one of the leading causes of death in the US. And it really is, a factor of, people overestimating their ability to operate vehicles while under the influence of alcohol. And really what happens here is we see this really sharp increase in the risk once we get to about that 0.1 BAC level. And so that's why typically in the US, 0.08 tends to be the legal limit, though, there is still quite a risk even at that limit. Typically, just some statistics here I'll throw out. Men do tend to be more likely than women to be involved in alcohol-related traffic fatalities. About 90% of intoxicated drivers involved in fatal crashes have never been convicted of driving under the influence in the past. So it really is sort of, some people say, oh, it's just one time, or, it's just one instance, when in reality, that's really all it takes. So sort of a serious concern here to be thinking about in terms of some of these behavioral effects. Also, it can have some effects on sexual behavior. Interestingly enough, it can enhance the interest in sex, but impair the physiological arousal. So more desire, but less ability. And so this tends to be linked to risky sexual behaviors, especially because of that increased desire. Blackouts, of course, can happen when the level of alcohol gets too high in the system, where periods of memory loss and remembering of the events take place. Crime and violence, alcohol is just generally correlated with things like homicide, assault, child abuse, suicide, things like that. So there is some correlations here with negative behavioral effects like crime and violence here. All right, so let's shift now into the physiological effects here and talk about not just behaviorally what it does, but what is it actually doing on the body itself when we're looking at alcohol here. So first off, we have some effects of that peripheral circulation, right? So generally, alcohol acts on the body to dilate and sort of produce that dilation of peripheral blood vessels. So typically, things like increased heat loss from the body makes people feel warmer, even though they aren't actually warmer. So this can be dangerous, especially in colder climates or when people are out in the woods or on cold nights where they feel like they're really warm due to the effects of alcohol, when in reality they aren't. And oftentimes people have in the past actually, had fatal incidents due to freezing and things like that. Also, it has fluid balance in the body. So it acts as a natural diuretic, which means basically it's going to increase your body's production of fluids. So you are going to have an increased urine production, increased urine flow. It's going to lower your blood pressure in some individuals, but generally is just going to make your body sort of work in overtime to pump out the liquid from your body, which can be one of the detriments to alcohol as well, where it actually dehydrates you because even though you're drinking a lot of liquid, that liquid is acting to actually tell your body, hey, I need to work in overtime to get all this liquid out from me. So that's why oftentimes people have, again, increased urine flow when under the influence and drinking lots of alcohol. But again, it actually is acting to dehydrate the body more than anything. It can also be tied to different hormonal effects. So chronic alcohol abusers tend to develop a variety of hormone-related disorders. Some examples are things like testicular atrophy, impotence in men specifically, and oftentimes impaired reproductive functioning in women as well. All right, now let's kind of end here with some causes for concern. And there's a few different ones to kind of talk about here. So alcohol, of course, has quite a bit of dangers to go through. And so let's kind of talk about each one a little bit. The first one obviously is just general alcohol toxicity, right? So increasing risk of injury and death due to just consuming too much alcohol. So a couple things I want to point out here. General advice: if you or someone is ever in a position where you are with someone or see someone who has had too much to drink, never leave the person alone, right? Don't leave them alone to sleep it off. This can be quite dangerous. Place the person on their side, right? And monitor their breathing. And if needed, really take them to an emergency room or something like that. Never be afraid of recourse or legal actions for this. It is always better to play it safe and take that route. We can also talk about hangovers, right? So, hangovers specifically are not quite well understood, but often some of the symptoms include things like upset stomach, fatigue, headache, thirst, depression, anxiety, general things like that. And some of the potential causes, what we think might be going on here is, like we said before, remember, alcohol is a diuretic. So your body's going to be pretty dehydrated in the morning after a night of consuming large amounts of alcohol. So one of the things that can help alleviate hangovers is just to consume more water and rehydrate your body. Of course, things like your body having short-term adaptation to the alcohol, where now without those, without the presence of alcohol in the system, you get sort of this, imbalance of equilibrium in the opposite direction. So you feel much worse about that. But overall, still not fully understood exactly what all the factors that make up a hangover are. But I think the number one thing is rehydration to overcome that. Chronic disease states. So there's a few of these here. When we talk about chronic disease states, these are oftentimes associated with longer term or prolonged alcohol use. So one of the general, more dangerous or long-term issues here are the overall effect or loss of brain tissue. And so this can actually be associated with a few different things. Number one is alcohol brain dementia. So you can have some of these dementia side effects because, again, certain brain tissue is actually being deteriorated and lost. We also have the specific Wernicke-Korsakoff syndrome, which is basically a chronic mental impairment, which is produced by heavy alcohol use over long periods of time. And there are quite a few documents on this going into sort of some of the risks and dangers with this as well. But overall, again, just mental impairment that's produced by long-term alcohol use. Heart disease, of course, right? Cardiomyopathy, heart attacks, hypertension, strokes, things like that. Those are all associated with long-term alcohol use. Interestingly enough, moderate alcohol use, at least in the data, has been shown to potentially reduce some of these risks, specifically with heart attack. Liver disease, of course, remember we mentioned the liver is responsible for eliminating 90% of the alcohol that we consume. And so it's really working overtime and dealing with sort of this nasty substance when we consume it. And so it has one of the highest risks of disease for those prolonged uses of alcohol. Then, of course, different cancers, lots of cancers are associated with, again, long-term alcohol use. Cancers of the mouth, tongue, pharynx, larynx, esophagus, also the stomach, again, liver. A lot of these different areas, rectum, colon, are all associated with different types of cancer related to long-term alcohol use. And then, of course, we also have the immune system here, where there are some immune system deficiencies, and we see that decreased immune system response for those who have long-term alcohol use. Let's also quickly talk about fetal alcohol syndrome. So this is another concern, again, specifically for children who are born from parents, specifically mothers in this case, who use alcohol during pregnancy. So it's fairly rare, but it's prevalent in about 2 out of every 1,000 births. And again, comes along with some long-term life issues for the child, often similar effects to people with mental retardation or Down syndrome effects as well. Then we also have, I skipped. We also have fetal alcohol spectrum disorder. So interesting about that is that's a little bit more common if we define this sort of on a spectrum where we see about 80 per every 1,000 births. And this, again, just has more abnormalities associated with it. It's not quite as strong as the specific fetal alcohol syndrome diagnosis, but does still come with increased risk and things like that. All right, then we have withdrawal symptoms, right? So obviously withdrawing from alcohol can be quite dangerous, especially for those that have had prolonged or longer term use with the substance. Physical dependence is pretty strong for alcohol. Again, remember, if we think about this from a physiological standpoint, alcohol is acting on those GABA receptors, right? So GABA is responsible, and glutamate, but it's acting to essentially disrupt the natural state or the equilibrium of the body to be used to being more calmed down. So your body's going to try to adapt to that and create probably more glutamate to try and bind, and maybe it might actually produce less GABA because it doesn't need as much to be as effective in doing its job. And so over time, if you then just remove alcohol from the equation, you're going to be left with a system that is overstimulated because there's extra glutamate now floating around and being produced, and less GABA to reduce that down. It's one of the reasons why we see some of these, specific, effects when people are going through detox of alcohol, things like shakes and tremors, because your body just can't tell itself to calm down and to settle because it's lacking GABA and it has too much glutamate in it. So what we see here with this detoxification process is sort of 4 stages of withdrawal. And so they kind of range in severity here. Stage 1 tends to be things like tremors, excessive rapid heartbeat, sometimes hypertension or heavy sweating, loss of appetite, insomnia. So again, your body is in a heightened state because it can't calm itself down. Stage 2 has things like hallucinations. They can be auditory, visual, or even tactile hallucinations, and often rarely seen might be olfactory signs as well. Stage 3 has things like delusions, disorientation, delirium, and amnesia as well. And then finally, stage 4 includes things like seizures. So normally medical treatment is sought in stages 1 or 2, and rapid intervention sort of needs to be done often with a sedative drug to prevent stages 3 or even 4 from occurring. So again, withdrawal, detox from alcohol can be quite dangerous if not done in the right way. All right, and then lastly here, we'll end with alcohol use disorder, just general views of alcoholism. And there's 2 kind of approaches here, 2 general views. We have the view of Alcoholics Anonymous, or AA, which is their opinion is basically that alcohol dependence is a progressive disease characterized by loss of control over drinking. And so the only way to really treat this is to abstain from alcohol entirely. So they really treat this as a disease, and that alcohol dependence is the primary disease and not the result of some other underlying cause. So again, abstinence is the only way to treat alcoholism from the Alcoholics Anonymous viewpoint. An alternative view here is the American Psychiatric Association diagnostic, and so the DSM, the DSM-5. So this really is, takes a slightly different approach and talks about some other factors that could be leading to alcoholism. Things like cognitive or genetic factors might be used here as sort of precursors to why individuals might have issues with alcohol, and can be also used to help treat or reduce some of that alcoholism use without fully eliminating alcohol from this, entirely. All right, so that is the end of this chapter and this section. So again, remember this one just covered alcohol, chapter 9 here, but we're going to wrap this up and end with this.